First, we're going to do active range of motion extension. So for this one, you're going to have them laying supine with a towel under the humerus to help get a true motion. And then first you'd have them demonstrate the motion, but she's already in extension. So you can just observe that. And then you're going to put the fulcrum over the lateral epicondyle with the stationary arm over the humerus pointing towards the AC joint. And then the motion arm is going to go over the midline of the radius. And normal would be about 0 degrees for that one. And she's at 2 degrees, so she's just slightly hyperextended. And then next I'll have you sit up and we'll do active range of motion pronation. So for this one, you'll have them seated with their elbow flexed to 90 and then the hand in a neutral position. I'll have you hold this. And then for this one, you'll have them demonstrate the motion first. So I'll have you turn your hand like this, keeping your elbow at your side. And you're going to have the stationary arm perpendicular to the floor with the fulcrum lined over the third MCP joint and the stationary arm lined up with the pencil. I'll have you do it again, keeping your elbow at your side. For this one, normal would be about 90 degrees. She has a range of 92, so she has just slightly increased range of motion. Next I'll have you do passive flexion. So I'll have you seated with your elbow flexed to 90 and your forearm supinated. And then you're going to support at the elbow and then hold at the distal forearm. Just going to bring her hand to her shoulder. And for this one, it should have a soft end feel due to the muscles of the forearm coming into contact with the biceps brachii muscles. And then next we're going to do passive range of motion pronation. So for this one, we're going to have them seated with their elbow flexed to 90 and their forearm and hand in a neutral position. And then gonna support at the elbow again and then hold the bottom part of her hand. Just gonna turn it over. For this one, it should have a hard end feel due to the radius coming into contact with the ulna. And then next we'll do manual muscle testing extension. So you want seated, flexed to 90 at the elbow, and supinate her forearm. And I'm gonna hold at the posterior distal humerus to prevent more motion. And then going to resist on the distal forearm. And then for this one, you're testing the pronator teres, pronator quadratus, and the brachioradialis muscles, and she had a 5 out of 5 strength because she was able to fully resist and break against my resistance. Next we'll do Vera's stress test. So for this one, I'm going to stand on the medial side of her arm, of the affected arm. For this one, you want to just slightly flex the elbow to about 20 or 30 degrees. And then I'm going to hold at the distal forearm, and I'm going to hold at the elbow, palpating the lateral joint line. And then you want to just apply some varus force. And for this one, if there's pain or increased laxity when compared bilaterally, it's indicative of a RCL sprain. Next, we're going to do milking sign. So I'll have you come sit in this chair. And then I'm going to stand behind them with their arm in a throwing position at about 90-90. I'm going to support at the distal humerus. Then for this one, you just want to hold the thumb and apply a valgus force in different positions of flexion and extension. And for this one, if there is pain or any laxity of the medial joint line, then it's indicative of a UCL sprain. So I will do Mills test, so you'll have them standing for this one. And you will have their elbow flexed to 90, forearm pronated, and then you're going to support around the elbow, and then your other hand's going to hold them in a flexed wrist and finger position, and then you're just going to passively move them into extension. And for this one, if there's pain at the wrist extensor and supinator attachment on the lateral epicondyle, it indicates lateral epicondylitis. Now we'll do Tenel sign, so you can have them sit back down for this one. You want to flex them to about 80 or 90 degrees. And then you're going to find the ulnar nerve within the cubital tunnel. Right about there. This one. Just going to tap over that. And if there's pain or paresthesia in the distal distribution of the ulnar nerve, it's indicative of ulnar nerve pathology. And then the last one I'm going to do is pronator teres. So I'm going to have her seated with her elbow flexed to 90. I'm going to flex the wrist and the fingers. Just kidding. No, that's wrong. I'm going to, so still hold the elbow at 90, and then you're going to hold the wrist, and you're going to strongly push against pronation while bringing the arm into extension. And then for this one, if there's tingling or paresthesia within the thenar eminence and the palmar aspect of the first through third digits, then it indicates compression of the median nerve due to hypertrophy of the pronator teres muscle. That's